Let's now talk about the key differences between osteoarthritis and rheumatoid arthritis. Osteoarthritis is a degenerative disease caused by excessive wear and tear on the joints. Rheumatoid arthritis is an inflammatory disease caused by an autoimmune disorder. Osteoarthritis causes end of the day pain. So pain is increased with activity and decreased with rest. This is the opposite with rheumatoid arthritis, which is characterized by morning pain. So pain will be worse after rest or immobility and will improve with activity. Osteoarthritis affects specific joints, and we will have unilateral joint pain. This is different than rheumatoid arthritis, which affects bilateral and symmetrical joints. Osteoarthritis has those Bouchard's and Heberden's nodes that we talked about before, as well as crepitus. With RA, we have the swan neck and boutonniere deformities, as well as ulnar deviation. With osteoarthritis, we have a negative rheumatoid factor, and with rheumatoid arthritis, we have a positive rheumatoid factor.